It's Mari McInerney from Croaky here at the Safer Care Victoria annual conference here on Giant Steps. And the final keynote for day one is Christine Nixon, very well known in Victoria and beyond. Christine, would you be able to just introduce yourself and your many affiliations?
Sure. I'm Christine Nixon, and I suppose I'm mostly known as having been the former Victorian Police Commissioner in the early 2000s. But since, of course, I was responsible as the chair of the Victorian Bushfire Reconstruction Authority, and then Monash University, Monash College, and very lately, and only for the last 2 weeks, I've been the chair of the Royal Australian College of General Practitioners.
So let's come back to bushfires if we can after, but if we could talk about that. You were on the board for 2 years, I think, at the RACGP, and you're at Monash Health. You are?
No, Monash University.
Monash University,
yep.
Sorry. Mm-hmm. What's got your interest in health?
Well, actually, it really became just a circumstances, I think, more than anything else. I gave a speech at the one of the conferences for the GPs and about leadership, and I was a bit taken by them and by thinking through the issues. I'm always a bit, curious around challenges that people are facing, and of course I have my own GP, and so I guess it was that I was interested in thinking about. And then they asked me to become part of the board as an independent to finish someone else's term, and then I was elected by the board itself, and now they've elected me as the chair. So I'm really interested in the big public policy issues that people are dealing with in this area, and it kind of reminds me of lots of other sort of complex systems. So that's where I come from. So I figured that yes, I can chair a board. I've been doing that in different places for quite a long time. I'd like to figure out how we kind of think through what are the major challenges and what are some of the solutions to make people safer and healthier and all of those challenges.
Any thoughts on those at the moment about what priorities will be?
Yeah, I think we're just thinking through. I mean, obviously, best quality care available, but I think prevention needs so much more work. It needed it in criminal justice. It needs it in health. So there was a bit of a similarity in that for me. And so I think you've got to work about that. You've got to also let people's voices be heard. So I think there's a much bigger role in advocacy. Just some of the issues, supporting doctors. How they support each other. They're things that I think we need to be really thinking through and seeing what we're doing and thinking about how that might change in the future.
Have you been away from the police force for too long to ask, are there similarities or great differences in police and
well, they're different clearly different kinds of characters involved and different reasons but maybe the reasons aren't different. The reasons are to make a difference in people's lives. I think that's fundamentally why police officers and people join Victoria Police or other police organisations, and I think the same thing applies certainly to the GPs that I met. They're just the ones I met, just staggeringly good. Doing great stuff, trying to keep up, trying to make sure they're supporting their patients, and broader community. I think it's it's just not just our patient. They're working to make the health of Australia better, and I think that's a great thing, and very similar to making Victoria a safer place, for instance.
One of the things you're most known for is pathfinding as a woman in senior positions, and you made the point that we've only had two female police commissioners
in the whole of the
so it's not really rocking yet.
No, well, I mean, sadly, actually, the rest of the world's not much better. So I think it's getting better. Like the head of the London Met, she's a fantastic woman. She came out. We're getting numbers of deputies, so it's kind of pushing the boundaries up, but we just need to push the step further.
Are you seeing similar gender issues in medicine and health?
I'm not sure I've seen enough. I mean, I think there are really issues about women and the way that flexibility, about how they can have a career. I mean, I'm one of the ones that thinks you can have kids and you can have a career, and you can have it at the same time. And that's because we need to fix the systems that allow that to happen.
Yeah. Back to your other big role, which was in the Bushfires Reconstruction Authority, I think.
Yep.
I'm just wondering how you're feeling about the debate that's going on at the moment, the scenario we're looking at, where we're looking at terrible bushfires, long bushfire seasons.
I mean, I think we learned some lessons out of the Bushfire Royal Commission, but whether we implemented them is a whole other issue, I think. But certainly, I think people are obviously now more aware. I mean, I was looking at the app today, which we didn't have back in the beginning. So I think there have been some pluses, but I think people underestimate the power, and what we're hearing communities talk about now, all over Australia, is they've just never seen anything like it. Well, that's what we had in 2009. 1,000 fires across the whole of the country, whole of Victoria at the time. So I think people really realise this is, and I listen to the fire chiefs, who are trying to advocate now to say this is worse. This is just about drought. This is the worst situation we could be in, and it is about climate change. And it is about the fact that we need to recognise what's happening to our environment and put into place steps that can mitigate the risk to people who want to live in those locations. And if you can't do that, as they've been saying now, as they said today in Victoria, for instance, get out of those remote communities, take yourself into town, look after your neighbours, look out for old people, because that's another piece of it, the number of deaths we had. So I think we really need to be listening to the experts in this case, and they are the ex-fire chiefs or other people who've been involved.
We also had, I think, in Tasmania today, the emergency department physicians who are meeting, their annual meeting, and they went on a protest march through Hobart about that we need action on climate health. Yeah. Are you going to see both parts of that, your world come together on that?
I mean, I think that's probably true, yeah. I think it is about thinking about, what the research and evidence is telling us. Like, it's overwhelming that we need to be doing something about it, and I'm not surprised at all that people in those circumstances will be wanting to say, you've got to listen to us.
Can I put you on a curly one then in that case, where, as a former police chief, with the idea that what is actually going to happen is a crackdown on protesters? How do you feel about those sorts of protests?
We live in this country, and people have a right to protest for all the good, absolutely fundamental reasons. And it is right to protest. And I used to say, we people have a right to protest, and we are responsible for facilitating that right to protest. I mean, every kind of day in Melbourne, there'll be a protest, and the police will facilitate it, and they'll negotiate and they'll work their way through. And as long as people within a boundary of not helping and not harming others, people have a right to protest. That's what's called democracy, and that's why we live in it.
So it's politics only that's
I think it's just silliness, really. I think, people got a right to protest, and I'm not talking about terrorists and everything else. I'm talking about, citizens who should be heard. That's why we live in this country.
Fantastic. Before I let you go, because I've kept you a little bit longer than I promised, any takeaways from being here and being in the health and qualities?
Oh, look, I think it's lovely. I mean, the notion of giant steps, I think, toward better and safer care, I think is important. I think this whole collective of people coming together is a really important piece. There is power in all of the aspects. And if they can just kind of get a concerted effort about what the new system, the better system will look like, then I think we'll be all better off.
Fantastic.
Thanks.
Thank you very much for your time.